Hey guys, Dr. Mark Tam here, hair transplant doctor. Today we are in this special episode. We have both guests, Sunil and Su, joining us to talk about all things hair. So, hello guys.
Hello.
How you doing?
Yay! So, in our first episode, we talk about specific medications, and some of you may already had some questions. And in the second episode, we talk about SMP treatment. So, together with a panel of three of us will do hair transplant, medication, and SMP. So, hopefully, we'll give you a little bit of information on how it works together individually and answer some of your questions. So, Sunil, tell us a little bit. We have so many patients who had treatment between us from hair transplant treatment, scalp micropigmentation to medications. And what's your feel and or take on these combinations?
Combination of what I call hybrid treatments give you the best, outcomes completely. Because it's not just one thing that will solve the issue. For example, with what you do as a transplant is kind of giving the foundation. What I'm doing is giving the seeds to make sure that the place stays, all kind of growth, etc. And I suppose where Sue would come in is the areas where me and you can't get to is to kind of have that, I suppose, camouflage and kind of in a very artistic way. I've got to see, I saw your Instagram video and there's a lot of art that goes to it. And where you said in the previous episode about questionable work,
Yes.
you have to really, it's like an artist and when you're painting something, to make it look realistic, you need to have the skills.
Yes.
And that's certainly what you have. So
you.
that's really good. So I think the combination of the three
It's cool.
works really well.
It is cool.
But we need to get the right people into the right place. And it depends on where the journey needs to start as well.
Well, actually, that's a good point. I mean, when they come and see me, then of course, often they are specifically looking for hair transplant treatment, and that's where I usually see him. But I'm sure when you will see a portion of patients who are looking at medications, maybe they have a transplant. I don't know. Maybe they have or haven't. Different sort of a point. Same for you, Sue. What are what are the typical ones that you see?
Yeah, so we see variations, and when people come to us directly, they've gone through a journey of self-treating first. Then they've realized that whatever they're doing isn't working, so they try and get expert help. They may try these online pharmacies with online forms and then not succeeded through that, because we're very specialists and we do very personalized treatments. What I'm trying to educate people is to come to us first, because I believe that's a gold standard way to go, regardless of whether they're doing a hair transplant or thinking of SMP, because what I'm doing is trying to enhance what they naturally have. What you're doing is to harvest from what they have and replace it, and redistribute. And I suppose what Sue's doing is where those things can't happen for any reason, is to kind of create the illusion of it happening. So that all three have their place, and all three will be in a different part of the patient journey. But the key thing is for the patient to understand that these options are available.
Yeah, absolutely.
Lots of patients probably don't know about SMP,
Yeah.
don't understand SMP, and where you said 80% of your patients, clients, I keep saying patients, but I suppose you call them clients. But what the reason for that is that women are used to kind of eyebrow tattooing and doing those treatments. Men don't know, and men may think of this like makeup.
Yes.
Yeah. So we need to break that taboo. And for example, when you speak to patients and when I speak to patients, if we speak to male patients that this is an option for them, then maybe more will go for it.
Yeah.
So with us educating male patients, and I suppose when you see male patients, what journey have they gone through? Do they come directly to you or recommended by partner?
I get a lot of recommendations from Dr. Mark Tam. I had very various of cases also. Female, male, it just varieties of clients. They come with different hair loss issues, whether it's alopecia or it's just with after giving birth, after hormones are going up and down, they lose hair, whether it's stress related. Like you've said, a lot of my clients, 80% are females. And I also think it's because women, we do a lot of treatments for ourselves. We do a lot of, let's say, like hair dyeing, perming, treatments, Botox, fillers. There's so many aesthetic treatments that we do. And SMP is just part of it. For men, the most they do is go to barber once a week or two, and that's what they are.
Yeah, and I think men are changing, and men are
Yes,
getting
which
into.
I love
Yeah.
that they're taking care of themselves and they're self-loving and they're looking and researching for more treatments that could make them feel better.
And I think clinics need to be more welcoming to
Male.
male clients in that, and you know,
We are.
no, but I think because we've gone through this journey with, you know, kind of the work that we do, and because women are a bigger industry commercially, that's why everything's focused. The colors are focused on them, and when men see certain websites, they see those colors, they see those fonts, and think, maybe this is not for me.
Yeah.
Which is very tricky, but that's you know, all the psyche of the consumer. But I think really what we all need to do is educate them. So every interaction we have, we need to tell them there's options, and you know, there's options of hair systems as well. Which fantastic.
Looks
Have you
fantastic.
seen a hair system transformation?
Oh yeah, hugely. I mean,
It's
They're
it's going to put
insane.
me and you out of a job.
I
You
forgot.
can't get into water with it though. You can't go on holidays.
I forgot to mention that when my grandfather actually was a hairpiece trader, so
Oh,
he sold
amazing.
hairpiece. I didn't know that when I was a kid, but my grandpa passed away a long time ago. But that was what he does at that
that's
time.
amazing.
So I grew up in the
Hair industry.
My extended family had a big hair salon, so as a kid, I spent a lot of time in the salon as a model. So I would just turn up in the weekend and sit still, let someone cut your hair. Practice cutting your hair, and we'll get ice cream afterwards. So we spent a lot of time in the salon, and my dad at some point owned a hair salon too, and I've extended cousins who is in the industry. So it's interestingly, I feel like this has a third generation. We are still doing hair, but in a different way. So that's kind of
that's a really amazing story.
Yeah, and true, and but I didn't know in that. So only after when I started doing hair transplant, my dad told me, you know, your granddad used to do that. I was like, really? Oh, cool.
I have a friend who does hair systems, and you know, we send some patients across because again, it's what's comfortable to the patient, what fits their lifestyle, because there's a maintenance that needs to be done with the hair system, and like you said, there's certain do's and don'ts,
Yes.
restrictions with that. When it comes to kind of hair transplant and medication, there's also costs involved. So, and I think us as hair experts, whatever industry we're in, we need to understand what the other industry is doing. And these kind of podcasts are really good, not just for the patient, but also for us as practitioners to learn from each other and to be able to, if I have a patient, you know, now I've met you, it's easy for me and comfortable for me to say, you know, go see Sue, because that's what you need.
Yeah.
But yeah, patient education is, and us as practitioners keeping on top of what needs to happen and what type of patient is suited for which treatment.
Yes, I agree.
I think we probably our patient probably have cross path between us quite significantly without us sort of knowing whether it's specifically yourself or they might dab into hair transplant, they might do some self medications, maybe come to you, maybe they went to someone else, and maybe they just explore about SMP. But actually, this is a rare chance that we actually the three of us get sit together in here. But I think we we probably share a huge amount of patience between us in terms of caring for them. But another point that just now you're mentioning, male patients, client, they're less to it, and I agree. And we men generally tend to look for solutions. That they think hair transplant, okay, we just have transplant arm source, but actually it's a lot more complicated and a lot more. Hair transplant is great in great hands, but there are a lot limitations. More that can be done, cannot be done, and
No, and I think what's really important for and we have a lot of talks with patients about this when they're considering hair transplant is, especially when they're quite young, because there's a limited estate for them to be able to take the donors and then have the hair transplant. And if they have it too early, for some instance, they may not have enough donor for later on. And hence why I think that them coming to me first to kind of build what they naturally have gives them a bit more time to think about the hair transplant and a better result and more longevity in the sense of their, someone who's in their 20s has still 3-4 decades of
potential hair loss years.
Potential hair loss, and also all these different ups and downs of life, with whether it's, medical reason, diet, or just, simply the bad lifestyle that they're going through. The hair follicle is going to go through a lot. And not just for men. What's really interesting is with women is that the hair follicle goes through its own menopause before clinical menopause. So hence, when kind of age 30, women will start to feel that the hair is dry, brittle. That's because the hair, but the hair follicle is interesting that it goes through its own, hair follicle menopause.
Cycle, yeah.
So we've created a formula specific for that. We call it MP2 formula, and it's focused on women in that age group who will feel their hair kind of, it's like the bad hair day.
Yeah.
Brittle hair, dry hair, no matter what they're doing, it's not
The same.
not helping. So they need to start doing that now. And even with menopause, women 5 to 10 years before they reach menopause, their body is changing completely. And then within the menopause year, within 1 year, everything is changing. So I focus a lot on women going through that journey because they need a lot more than just your standard minoxidil that they, when they see the GP, that's what they are told.
Yeah.
Just go and buy minoxidil.
Topical.
They need a lot more than that. Yeah. With men, it's simpler. With women, there's a lot more to deal with. And do you do hair transplant on women, or you focus mainly on
mostly guys? But we do have ladies for transplant. But ladies are a little bit tricky in terms of when it comes to hair loss. I think those that I generally take on and treat lesser of hair loss, but more on they might want lowering of the hairline that maybe it wasn't due to hair loss, and we do have a few. We seem to have a small selection of patients who had scarring alopecia, such as FFA, LP, and so they have a band of hair loss in there because of the immune-driven conditions, and since then they may require. Once the condition is stabilized, it had transplant. So still a subset of a smaller group of patients, but a majority of the men with general sort of thinning on top there is a bit tricky because the areas can get a little bit bigger with time, and there is usually a fair amount of hair that is still there. So on a technical level, it can be a bit tricky to place, to try to work in between the hair, to put the hair, transplant the hair. And of course, with my work, a lot of time we shave the back and the side where we take the hair from. That's hugely unpopular, I tell you.
It's
hugely unpopular with ladies. And one of my female patients I just saw a couple of weeks ago was, thanks, doc. And the hair is only just coming back longer.
It's a different journey for women, certainly. It's there's different issues to deal with. But again, what worries me as well when, especially women, because they tend to suffer more with the scarring alopecia. And what worries me is they do things without speaking to someone. And with things like, CCA and LP, if they don't understand that diagnosis, they get permanent hair loss very quickly. And even with, SMP work, there's a lot of SMP practitioners who don't really understand that and may just do SMP, and SMP is actually aggravating the whole issue. So that's why it's very important. The message to really give is before you do any treatment is to speak to an expert.
Get a diagnosis on that one.
We do an initial consultation, no kind of, force to do anything. It's just all I want is people to be on the right track. Because if they have certain symptoms that show that scarring alopecia is there, that needs to be sorted straight away. There's no messing about, because some are so aggressive that within months they permanently, lost, and they have no other option but to wear systems. So women they need to reach out and speak and talk to us so we can get them on the right treatment.
Cool. Wow. If you're watching this, guys, ladies, and again, Sunil, that's Sunil's number.
We'll press it right here.
But I've got lots of information on my blogs about this. So if they go on growback.co.uk, go to Hair Talk. I've spent a lot of time writing these blogs, and the blogs is not something that I sit and think, what am I going to write? It's when a patient comes in and it's a new situation for me, and I'm thinking, okay, how do I spread the word to everyone else? So that's when I create that blog. So all our blogs are based on patient experiences.
I have a question. So is minoxidil suitable for everyone? For people like me, I don't have hair loss, but I definitely lost more hair than before.
So minoxidil is what everyone would think of as a kind of the first line treatment. It's the ingredient that's licensed. It's a good ingredient. When it works, it's really good.
Yeah.
But how do you know it's going to work for you? So minoxidil is a prodrug. It needs to convert to minoxidil sulfate in the scalp for it to be active to give you hair growth. There's an enzyme that makes that conversion happen. But let's say you don't have that enzyme. You apply as much minoxidil as you want, nothing's going to happen. You may have low amounts of that enzyme, and you apply a low dose of minoxidil, nothing's going to happen. Yeah. So our DNA testing will actually test for that enzyme.
Oh.
And we'll see whether you have enough, not any, or a small amount. So then that's why we do the adjustment of the treatment. So if you have enough and you're converting it really well, we don't need to go on high doses. If you've got none, what's the point of using minoxidil? But if you've got a small amount, then we use minoxidil, we either increase it or there's other ingredients to help convert and upregulate that enzyme. So yes, minoxidil is a good product, but to the right patient.
And if I stop taking it, would it shed?
So like anything, whatever you're doing. So, and I use brushing your teeth as an example, because if you don't brush your teeth every day, what's going to happen? They're going to rot, they're going to fall off. Minoxidil is an ingredient that will help enhance the density of the hair follicle, kind of increase the kind of the growth phase. If you stop using any medication, you revert back to natural state.
Yeah, it's like taking multivitamins and not taking.
Yeah, but again, with minoxidil, the reason why this minoxidil shed, and also when you withdraw from minoxidil, you shed quickly, is just because of the half-life of that medication. What that means is it's quick acting, but also when you withdraw from it, it's quick withdrawing.
Right.
So you'll revert back to natural state quicker with minoxidil. So a lot of people, when they use minoxidil for years, they get confident. They think, I don't need medication anymore. Come off it, and then all of a sudden they go back to how they would have been if they didn't use any medication. Because the aging process is still there and still happening, so the hair loss is happening.
What is the time frame that you can take a break from?
Minoxidil is probably something that you would need to do ongoing. If people wanted to come off minoxidil
A week.
or go on holiday,
Yeah.
so we have lots of patients who, when they go on holiday, they may forget, and then I get a message, I've forgotten my medication. Depends what type of activity they're doing, what's happening. But being away from a medication for hair loss for a week or two is not going to be an issue.
Okay,
It's
like
after
what's
kind of a month,
Okay.
then if you're not using that medication for a month, then when
Body
you
will-
reintroduce it, you'll get extra shedding. So minoxidil, the way it works, it signals to the hair follicle. Any hair follicle that's reaching the end of the growth cycle, shed now. It's because it wants to grow new hair follicles. So what happens then is when you start using minoxidil, 6 to 8 weeks later, you'll see shedding. But that's a good sign because that means you're responded to minoxidil. But then when you come off minoxidil, there's a gap of like 3 to 4 weeks where, the activity, the growth is happening, but then the signaling that minoxidil was giving to the hair follicle has stopped. So the body goes back to your normal state. That's why after a month of not using it, they'll start to see shedding 6 weeks later, and then minoxidil's not there, not doing what it needs to do. So you revert
Start
back
over
to
again.
But starting over is harder.
Oh, really?
Yeah. So once you stop medication, you go back to natural state. But remember, if you're using 2 years of minoxidil, you've aged 2 years. Your hair follicles aged 2 years. So then restarting makes it harder.
Hey, Sunil, got a question for you. I get a lot from patients. Let's say if someone who experience hair loss, they've been on the medications that they find a stable regime, let's say minoxidil plus finasteride, stable for good, I don't know, 5-10 years. Let's say they always worry that if I stop the medication, I'm going to be totally bald, as if I never take the medications a single day in my life. Can you
Yeah. So when you're using combination treatments like finasteride and minoxidil are the common ones that people would do because they're doing different activities. Yeah. So finasteride is stopping DHT miniaturizing the hair follicles. So you've been using it for 5-10 years. You've delayed that miniaturization process. So you come off finasteride, and basically what will happen is finasteride has a long half-life, so it's still in your system.
probably still a little bit lingering on for a while, right?
For a few months, the activity is still, is reducing, but it's still there. But what that's done is prevented the miniaturization. So it's not as dramatic. You will still go back to natural state, but maybe in a year and a half. Minoxidil is very different. What that doing is just keep signaling for the hair to be in the growth phase and thicker. And the hair follicle knows when to shed with this signaling. So minoxidil keeps that signaling going, so you're growing your hair. So when you come off it, the signaling has stopped. So then that's why you see the shedding quicker, because that's signaling. But when you've used combinations, again, within 6 months to a year, you will start to notice.
That's revert back to sort of a natural state.
Natural state means that they would go back to the state as if they've not used anything at all.
In that time point or previous time point?
From before. Let's say today we start a hair treatment plan, and they use it for 2 years and then come off it. Those 2 years, the reason the hair growth has happened is because of the medication. Once the medication stopped, within a year, they will go back to a natural state as if they haven't used medication. So whatever their natural biology was of decline of the hair growth.
We'll just go back to that that state.
Yeah.
So people, I get a lot of, sometimes people worry that when they started on the finasteride, they might use it for 20 years, and then if they stop doing it, they will be like totally.
If it was just finasteride that they were on, yes, they will still go back to natural, but it will take much longer. And when patients have used specifically something like finasteride for a long time and they're stable on it, sometimes it's also good to take a break from it, because the body goes into what we call equilibrium. So sometimes it's good to come off it, let the body reset, and then go back on the medication. I would say 2 years would be a good time.
It's like a holiday then.
Yeah. Treatment-free space.
Like a cheat day.
Yeah. so exactly. So it's. But if someone's used something for 2 years and it's doing the DHT blocking, remember, DHT is causing quite a lot of different things. It's causing inflammation. What inflammation does is reduce blood supply to the hair follicle. Reducing blood supply means less nutrition. Reducing blood supply means low oxygen. When you have low oxygen, DHT becomes stronger. So it's like a vicious cycle. And that's what happens in scarring alopecia. You've got this inflammation going on, reduce of oxygen, the hair follicle gets killed off. So that you need the DHT blocking. So once they come off the medication, there'll be a point they'll need to go back on medication. But that break, that holiday, needs to be tailored to that person, depending on the time length they've used it, depending on what else is happening. But it is a finasteride holiday, but you need to go back on it.
A lot of patients on finasteride always have this thinking. I mean, I've got side effect from the finasteride.
What are the side effects?
Well, Sunil can tell us about the side effect from the finasteride. It is probably one of the most talk about
for
subject
men.
for men. It's probably one of the most talk about subject on around hair loss.
Yeah, but finasteride, it does what it is meant to do. The prevalence for side effects is 6%. That basically means if 100 men were using it, 6 of them were going to get side effects. So those 6, the side effects could be really minor or could be really major. What we look out for is things that, there's different grades of side effects. Someone could get sexual dysfunction, so that could be erectile dysfunction, which is the main thing that men fear about. Also, the amount of ejaculation reduces.
Right.
So they're kind of the sexual dysfunction. The other thing can be mood alteration. So there has been recent things that have been on the news about finasteride. Patients buying it online, a year supply, no one talking to them about the side effects, and can cause anxiety, depression, maybe suicidal thoughts. So,
wow, it's pretty serious. Yeah.
but again, the prevalence is low.
Yeah.
Yeah. So, and again, it's about choosing the right product for the right person. So let's say a patient came up and they had a history of depression, anxiety, and things
You
like
won't
that.
prescribe them with that.
You could, but you need to monitor it. Yeah, but you need to explain to the patient what to look out for. Now, if you go through a change of mood, you won't know personally. It's the people around you
Yes.
that would notice a difference in your behavior. Yeah. But again, patients also know and feel something's different. But that regular communication with their prescriber is how you prevent issues happening.
Yeah, they need to be well aware of.
And if someone has underlying issues, so underlying issues may be like prostate cancer or, breast or chest issues with cancers. So things like testicular pain, nipple sensitivity, they're the two kind of signs I always say to my patients. If they happen, stop immediately, contact me straight away. Then I chat to them, understand what the side effect is, and we liaise with their GP to make sure we get tests done before moving on to onto those. The other thing with finasteride, which is happening a lot, is men kind of age 50 plus are, buying it online, treating themselves. Because 50s is now kind of the new dating age and back into the game as such. But what's happening is finasteride naturally would reduce PSA levels.
I see.
So there's a lot of men who've not had prostate checks, PSA checks. So when they have a PSA check, and because they're on finasteride, it's showing that the PSA is low.
Artificially low.
Yes. So then, there's some undiagnosed prostate issues and cancers that are happening because the blood test says I'm okay. Yeah. So whenever we prescribe to a certain age of men, we say, let's get your PSA done. Let's make sure if there's a history of prostate cancer in the family, let's make sure you get physically checked by your GP. So then we can safely go and get a baseline PSA so we know what your baseline is. Because if it's artificially low, you can miss out quite a few things.
Can be quite serious.
And this is why, rather than doing online form filling, you need to speak to someone because each individual, no one asks you about your history. And, with with patients, you have to ask in different ways before they give you information. We've had some patients who, after kind of a year saying, I've got now erectile dysfunction. And then I speak to them, I said, let's do this. And then they go, but before I started the medication, I was having this issue. But men are quite worried and not open about things.
Yeah.
they need to be
Which
open.
is understandable. It's a very sensitive.
Yeah, but we're here to make sure that we can do the best for them. But men need to be more open to us so they don't suffer, because there are ways to get this, get the medication, even if it is finasteride, but in different dosages. And hence also with the topical, by applying it topically rather than taking it orally, you're reducing that prevalence from like 6% to maybe 2%.
Oh, wow. That's pretty.
Because when you take a tablet, it's going through your whole system. When you're applying it topically, it's in the local area.
Just area.
And only small amounts go through the system.
So, when you take the tablet of finasteride, typically it's 1 mg, and when you use the topical, what are the typical percentage now?
So 0.25 would be, the papers out there that showing 0.25% of finasteride is equivalent to 1 milligram.
But 0.25% is, it works out as basically 0.25 milligram in 100 ml of solvent, whether that's
whatever
solvent.
solution that.
So you applied, you don't apply the 100 ml of those.
You apply 1 ml.
Yeah, which is 1% of the 0.25 mg in there. Actually, we my point is really is a fraction of the dosage that you would take compared to tablet, right?
Yeah, but it's equivalent in the sense that when you take a tablet, when you look at distribution, only that small amount will be reaching the hair follicle.
Wow. So all this time along, when we have this oral finasteride, we're taking a huge dose, and by the time it reaches to the hair, is a very small dose.
Yeah, but it's taking it orally is a bit more complex because it needs to convert, needs to stop the enzyme converting testosterone to dihydrotestosterone. But now the studies are showing microdosing orally seems to be working better than the 1 milligram.
What is microdosing?
Lower doses. So
lower doses.
Yeah, lower doses. So
you
even taking it 3 times a week rather and at half the dose or quarter of the dose seems to be more effective. So they these are things that there's lots of prescribers now playing around with different ways and different numbers.
It needs to be a professional like yourself who
100%.
monitor the
Not
patient.
ChatGPT. Let's not.
In case you're watching on this channel and you're thinking you're gonna do this, I think
Free
it's best,
consultation.
I think it's best to consult a professional.
And I'm sure you've had this as well. We've had patients who, because of the cost, online they may buy finasteride tablets, crush it, mix it in some solution, and then apply it to the scalp.
Like mix it in themselves.
Yeah.
A very ingenious way to do great.
But when you look at certain videos on YouTube and things, there are people who
DIY their medication.
Exactly.
DIY topical finasteride.
But that is a very risky thing to do.
Why is that?
Well, one, that the raw material is very different. When you make a tablet, you're mixing other bulking agents and things in there. It stops the absorption. But also when let's say you mix it in a solution, if it's not mixed well and you're applying it, you'll only get a certain part with a high amount of the medication and the rest with lower. You might get irritation of the scalp, inflammation, and remember that whole cycle of inflammation, reducing oxygen. You could detriment that, but also side effects could be higher. Even when they're making it, remember your fingers still absorb. Yeah, so these guys, mixing it, not using gloves or whatever it is, and just because you wear gloves doesn't mean you can do it. But there's a reason we have strict rules and we have, compounding labs to make this, because there's a reason behind it. Because we want even distribution, we want it to be effective, and it needs to be mixed to the amount that the absorption happens. And one thing about, with regards to fingers, a lot of patients, when they're applying topical, will use their fingers to rub their scalp. And, we supply them with a silicone brush and also a brush applicator, because what we want to do is minimize absorption, but you're also diluting, because when you're rubbing it in, some of it, although we don't have hair follicles here, they won't see the result on there, but you're absorbing some of it in here, increasing the chances of side effects, but also reducing how much is actually going on the scalp. By using a silicone massager, the silicone's not absorbing it, it's just spreading an even distribution around. So these kind of things really make a difference to someone's treatment. There's a lot of companies out there that use sprays.
Like applicator or something?
Would you
or-
recommend it?
Spray on.
Yeah,
Oh,
you know,
okay.
like using finasteride topical, but as a spray or minoxidil. Problem with that is it attaches to the hair. You want to get it to the scalp.
Direct.
You want to get it to the scalp. So those treatments are hit and miss. Yeah. So you know, that kind of education patients do need, and there's reasons behind it. You know, some shower and on wet hair apply the serum. It's going to dilute, drop, and again, you'll have a film of water, which may not
Gets
allow
in the way.
the penetration. So dry scalp is the best way to apply a topical.
So we talk about we touched on a few times on the inflammation. Is there things to look after? There's like an anti-inflammation, antioxidant things that you could put on scalp as a new thing.
So again, depends on the symptoms. And it was interesting that for your SMP, you get them to use Nizoral, you know, the ketoconazole 2%. So it's an anti-inflammatory, it's an antifungal, but there's also studies showing that ketoconazole 2% works like a DHT blocker. So some patients, we use that as part of the treatment. When we, especially when we deal with women, we inflammation is really key because hormonal changes will inflame the scalp. So there are, you know, shampoos out there with steroids that we could use. There are topicals that we can introduce the steroids in, or we can use things like antioxidants like melatonin. Melatonin is up and coming in our clinic with regards to.
You mean melatonin that you use for
Sleeping?
sleeping and
so
you travel and you sleep is good for your hair?
100%.
How
I've
do you
been
do
taking
that?
it every day.
So
I took one last night. I took half.
so taking it orally works differently to when you apply it to the
Oh,
scalp.
I see.
So the way the body knows whether it's daytime or nighttime, vitamin D should be taken in the morning or midday, and melatonin should be at nighttime. That's the only way your body knows that is day or night. Now, a lot of people with convenience will take vitamin D in the evening. Yeah, because you know they
What will
remember
that do?
it will change your whole sleep cycle. What that happens is then your cortisol levels increase, and that causes hair loss. So sleep is really important for hair growth. Yeah, but melatonin, when applied to the scalp, works like an anti-inflammatory, antioxidant. There's melatonin receptors, you know, in the hair follicles. It also mimics DHT, so it's taking the DHT place. So when DHTs come to the hair follicle, it's not attaching to it. So melatonin is really up and coming. We use this quite a lot in our patients. But again, the DNA profiling that we do, the trichodNA test, will tell us the response they will have to melatonin. So we then personalize that.
Melatonin is a prescription-only medication in the
Everything
UK,
we do
right?
is prescription only because it's unlicensed. So the only thing that's licensed to purchase over the counter is minoxidil, 5%. Everything else is prescription only. But melatonin, yes, as a oral, is prescription only here. But when you go to other countries, it's sold like a supplement.
like a candy.
Yeah. But, you know, melatonin is a whole topic on its own because it's an amazing, molecule. It's the strongest antioxidant we have because
The
it's...
strongest antioxidant.
Yeah, glutathione is the one that everyone talks about. Melatonin is kind of the hidden antioxidant because melatonin will convert to several other antioxidants in your body. So it's really powerful.
Oh,
So
wow.
people use it for longevity. And again, that's where the hair follicle comes in because melatonin is helping reduce the age of the hair follicle.
So can you tell people just by if they sleep well just by looking at the hair?
Do you know, the hair answers to a lot.
Yeah, and skin also. I heard from 10 p.m. to 2 a.m. is where the skin recovers.
Yeah.
You think that's similar with the hair growth as well?
The reason that timing is important is because of the sleep pattern.
Yeah.
So again, coming down to collagen and collagen drinks. When I speak to patients, they're having collagen drinks in the morning. They should have it in the evening, exactly for that time slot that you've mentioned.
10 to 2.
Yeah, so you take collagen, and you need to make sure these are collagen peptides, not collagen, because collagen peptides is what you need to work.
I see.
So collagen then has to be broken down, etc. So collagen peptides are ready, available biologically for the body to use. So if you take it in the evening and you're asleep, and that time, 10 p.m. to 2 a.m.,
That's when it starts working.
it's when it's doing the rebuilding, recovery, recharge. So that's why your skin looks better if you use collagen in the evening. Same with the hair, follicle. That time, 10 p.m. It's interesting you mentioned that, but that is crucial. Sleep is really crucial for hair growth.
At that time, is that where people also do some laser helmet around that time as well?
Yeah.
And,
So
and
The
does it actually help?
yeah, so we use the low laser light therapy for absorption of the medication that we use. So low laser light, odd occasions, not going to do much. So, but they are, if you use it regular, it's something to really do at least 2-3 times a week. The way I tell my patients to do is to apply their topical, then put the laser light, because the red light is increasing kind of the energy of the hair follicle. So the mitochondrial kind of energy goes up. What that means is also the way the medication will be used up in a better, more efficient. But also it helps the absorption of the medication that we do. So we get them to use it every night after application. What we tell them is it's not prescriptive. So if they go on holiday and they only take their topical, that's good enough. The helmet's there just to enhance things.
It's not a helmet anymore, isn't it? It's like a hat, right?
Yeah, it's they're really cool now.
I saw it. One of my patients who just showed me yesterday, and I almost thought it was like a normal hat. It's so slimline nowadays.
Wow.
Yeah, but the one that we supply is the Theradome one, which is designed so you get a lot
skin
of.
as well, like face.
Oh no, this we do specifically for the scalp. It's hard to get a combination because the shape of the face, the scalp,
everyone's different.
but it's where we want the red light to go. But the Theradome is really good because it's got ventilation in there. So when you've got these closed caps and things, it creates heat. Heat creates inflammation, and then we're back to that vicious cycle. So buying the right type of helmet is important, and it's also important to know the frequency of the light, because different frequencies.
What is a good frequency?
So around 610 to 680, 650, around those bits. But, the 680 is kind of the specific frequency that is required for the right penetration. If you don't get the right frequency, the frequency determines how far down the light will go. So if you don't get the right frequency, you're either hitting too high up, so there's no activity happening, or it's gone past it and too far down.
For patients who's already got the LED mask
For the
like
face.
for the lamp, the face, can they use it on their head as well?
Yeah. So we have
Yeah.
one in clinic, which is like the Dermalux, which is just goes over.
Yes, that.
So yeah, they wouldn't need to sit there, but
So they don't have to buy a separate one for the scalp, not necessarily.
not necessarily,
Yeah.
because the reason we go specifically for the helmet
It's
is,
because of all the
but the shape of it, putting it on, is
convenience.
targeted.
Yeah.
If you've already got a low laser light, which is a really good right frequency, if you're around, because the light spreads, so even if it's the arch, it will still spread and it will still have that activity.
Yeah.
Good thing about that is then you treat your face as well
At the same time. Yeah.
But there's other lights for the face that are designed for kind of cleansing, etc. But specifically
blue lights.
specifically for the hair follicle is the red for that mitochondrial activity, the energy that it needs.
I do have a question about the SMP and hair transplant surgery. We do have some patients who had SMP previously, and is it a way to work around SMP when we do a second, let's say, a further transplant in an area that is already has SMP? I mean, when we are working on it, has a hair transplant surgeon, has a hair transplant doctor.
It's annoying for you guys.
I wouldn't say it's annoying, but I just want to know from you guys' perspective, like from as an SMP specialist, is it okay to just surgically work on an area that has done SMP?
I tell all my clients you could do SMP before transplant and after transplant. So it doesn't matter.
Does surgery changes the level of the pigment, or does it make it more blurry? Or
Depends
seen?
on the area how you apply, I guess. For that's I've never experienced a client who's had SMP before and then did a transplant and then come back to me again. So I wouldn't really be able to.
When you're doing the transplant, you're obviously punching,
Yeah.
and then you're feeding it through.
Yeah.
So you'll be taking away the
So
SMP, wouldn't you?
in the donor area, we because we're aiming for the
So you're talking
specific
specifically
follicle.
about the donor area. is it?
No. The donor area, we most likely won't affect it because
Yeah.
let's say if someone had a transplant, then had some SMP in the back to make it nicer,
Yeah.
then the SMP would target an area that was extracted
it's gone.
last time, no hair. But then when we do the second transplant, we won't go in the no hair.
Yeah, you'll go
we
to
want to go
new
in for
donors.
the new follicles.
Yeah.
So the donor not so much issue, but it's usually sometimes when the area, maybe last time they had a transplant, then they had a SMP treatment, looks great. Maybe some of the native hair clearly didn't come to you, Sunil. So some of the native hair has started to thin a little, and so what is left with is the transplanted hair plus SMP. So sometimes I work on those area, and I do wonder if that actually changes, because when we work on, let's say here, when the recipient area,
Yes.
we use a small blade to make a recipient size. So basically, sort of make a little small cut, as short but the deeper in there. So sometimes I was wondering if when we did that, would the pigment on, let's say, on either side kind of travel down, or it's actually because it's so superficial, then it doesn't
It's
make.
super superficial, so I don't imagine. But you've seen the healed results, right?
Yeah, I mean, a lot of time for those that I have seen, I think I worry more than the actual what's happening. I feel like it's probably still very much the same.
It will be the same, I believe. Yeah.
And from talking to other doctors, it feels like the people just do that over it. But I still suggest them. There's a chance that we might upset the SMP with the work that we do, and I tell them, maybe prepare that have a little light touch up. I mean, it's always good to have a little light touch up after a while, right?
After a while, just to freshen up everything. Yeah.
If you see SMP gone wrong, and patients and patients come to you, is it just like a normal laser removal process, or how do you correct SMP gone wrong?
I either tell them, okay, you have two options. You could mask it with the airbrush SMP, which is done by the 12 needle technique, or you could get it all lasered off and start fresh with me.
That's going to be painful.
Very painful, because
I mean, the laser painful or the journey painful?
The
whole
laser
thing
removal is painful in itself, but the time you'll have to wait as well.
Yes, exactly. The
is
time you have to
probably
wait
about-
also is, and because it's so pigmented, you need many sessions to get rid of it.
But would that damage the hair follicle as well? I'm not sure.
There is a ointment that you put on top of your scalp to protect the hair, but I feel like that can be quite effective. It can damage.
Aggressive. It's
No,
aggressive.
I would
itself.
imagine they might have the hair might have absorbed some of the energy and travel down to the roots to cause.
Yeah, I think that'd be quite an aggressive process.
But then I actually had a patient who had some tattoo done on the hairline. I did a transplant to cover the tattoo, and she decided there is a little bit of that she wanted to do laser, and she did some, and the grafts
fine.
seems to stay pretty okay. So maybe there's a individual control on laser.
Depending on the also lasers also. For my eyebrows, I got my eyebrow tattoo removed in Korea. Super painful. But they did put ointment on my eyebrow hair to protect the hair. I did lose some of the hair, but they do grow back, but not fully. So
That's the other thing that when we've dealt with some patients who've had SMP, they've had kind of shock loss.
they went way too deep.
Yeah, so we've seen that.
I've heard that too.
Yeah, so
one of my actual patient had that.
Yeah.
He was in US, and I got a call. So it
so
happens.
So those kind of patients, I just need to, from my point of view, need to be very careful, making sure we treat that loss, shock loss first, because it's the disturbance that the SMP has done. So it's because they've gone too deep.
Too deep. They weren't
okay.
trained properly. I'm sure they weren't licensed. Yeah.
Yeah, but we have seen this, kind of shock loss, and also if people are suffering inflammation, so when patients come to me in clinic, we have a dermatoscope or magnifying camera just to see what the hair follicles are doing. Is that something that you do, or
we do just to see the before and after? Because sometimes clients with hair like me, when they look in the mirror, they're like, "Oh, I don't see any difference on the first session after the first session," and that's when I get it out and I show them like, here are the dots. This is the first session, and on the second and third session, this is what it will look like.
I suppose because lighting will play a big role.
Yeah.
Yeah. So when they're out in the sun, it will look different too. Yeah.
When they send me a picture and like a really, really weird bright lighting, I'm just like, no.
So you know, just how I mentioned, if someone had SMP done, had a bit of shock loss, and that's something that you can be looked at. Do you have a survival kit if that happens?
Yeah, so we have what we call a rescue pack.
Ooh. Wait, there's a sound effect.
And also patients who have kind of scarring alopecia before getting a hair transplant. You can put them on medication to stabilize that. But the shock loss is you have to re-engage the hair follicle. So there's something called proteoglycans, which is the hair is designed to protect itself from the rest of the body. It's what we call immune privilege. And proteoglycans surround the hair follicle. And also proteoglycans control how growth factors surge in different phases of the hair follicle during the hair cycle. So that's what we want to do, is kind of proteoglycan treatment for those kind of patients, but also some topical treatment to stabilize. And steroids tends to be one of the routes that we go down. There's also an ingredient called cetirizine, which is, everyone would know it as an antihistamine for allergies. But again, taking it internally and applying it on the skin works very differently. And again, melatonin is another ingredient that works well. But we do that on an individual basis. And again, the DNA profiling or the Tricha DNA test tells me as a clinician exactly what's happening with their hair follicle to be able to tweak this rescue pack specifically for that patient.
We get a lot of shedding from the post transplant. Is that something that you can do? You can help?
So yes and no.
Come on, Sunil.
But sometimes you want that shedding, right? Yeah. So that's why I tell the patients, especially when they've had their hair transplant, I'm saying, look, you're going to go through double shedding. You're going to go through shedding from the transplant. You're going to go through shedding from the medication I'm going to give you. So at the start, it's going to be like you've spent all this money and you're losing more hair. But there's a reason the body does it, because it's trying to take away all the old hairs and generate better hair. So in my game, it's all about time. Yeah, so time kind of sorts things out. So whenever something happens, I look at the timeline, look at what's happened, because when you have any stress that's happened to the body, whether it's metabolic changes or an actual stress, bereavement, job loss, moving house, 3 months later is when you'll see the hair loss or hair shedding.
They probably forgot about what happened at that time.
But at that time, they may have got a new recipe that we've created and they're going, this is what's caused it. So timelines are really important. History is really important, for that. But going back to the question about the loss or the shedding, that needs to happen. So it's probably more important to look at the environment, letting the loss happen, but creating a better environment for the new hair growth. And what's up and coming is exosomes.
It's been on journals all the time.
Yeah,
I mean,
but it's all new stuff, and it's so exosomes. Would you know what exosomes are? So exosomes are basically little small nanoparticles, so really small size, that you allow the absorption into the skin, and it carries information to regenerate hair follicles, skin. It's got all the programming that is needed.
There's a machine, no, where you go inside and it helps you.
That's the oxygen bit. So the similar kind of thing is that's giving you the cells more kind of energy, but this is actual information being carried that the body needs to reprogram how your skin, your hair is growing.
You take it orally?
It's applied
Topical.
on and then microneedled.
Is it true some exosome is coming from human, some exosome is coming from plant,
Yeah,
or some exosome is coming from...
so there's synthetic and there's human derived. So human derived in this country you can't inject, it's illegal, but you can use it topically.
PRP.
PRP is using your blood.
Yes.
Yeah, so PRP is good for certain patients, but my issue with PRP, which I'm trained in doing it, we have done it. Particular patients could need it, but PRP
there's only a certain.
Well, you need to have good growth factors in your blood for it to work. So how do you know you've got good growth factors unless they measure the platelets, or again, our DNA profiling will say whether you're making adequate growth factors. If you're making really good growth factors, then your own blood will help. But if you majority of people who suffer hair loss, they're suffering hair loss because they have a deficiency in something, and usually it's growth factors.
And you try to use their blood to try to do that, and that doesn't...
It's like a hit or miss.
It's not effective enough. But again, with PRP, there's a lot of inflammation being caused, and inflammation is not good.
Right.
Yeah, for the hair follicle.
Because I've had some friends who's done it, even me, but I did it for my skin. 0 results. I think it was actually didn't do much for me.
It all depends on your blood.
Yeah.
How good is your growth factors?
The doctor said your blood seems very healthy. I'm like, okay, I'll take it.
But did they measure the platelets?
No, exactly.
They just looked at it.
Yes.
Yeah. So
it's a very healthy blood, and I'm thinking, okay.
Yeah. So
It's red
coloring. Coloring
colour.
is there, but again, my preference is moving towards the exosomes because it's standardized. It's carrying the right information. So it's not. It doesn't matter how much growth factors you have because it's giving you the information there. By microneedling, you're creating these micro injuries. So the way growth factors surge to a certain area is when you have injury, is how wound healing happens. So if you cut your skin, the skin repairs itself because the body knows there's an injury, it will surge growth factors repair.
Yeah.
So hence why you need to do some sort of like microneedling to allow that natural growth factor to happen, and then allows penetration of the exosomes into the layer of the skin of the scalp.
This exosome, is that like fluidity, or is like a cream, or is that like a
So
gel?
it comes in a lyophilized, so it's a powder.
Oh.
And then you've got a diluent, and then you mix
Dilute it.
and you
so
create
you
a
have to
serum.
mix it fresh every time?
Yeah. It's not something, once you make it it only lasts 24 hours.
Oh, so
So it has to be.
Quite like
You have to
the
apply it within an hour of
cool.
that. So there's we've got a synthetic one which we now offer to patients with added growth factors. So they make it at home and apply it and use a device that we give them to do exosome treatments at home.
Shake it. You add A and add B.
Yeah,
and then
we train them. So we do it.
Wow.
We do
Go on training for
Yeah,
that.
we do a video consultation, and we send them some videos on how to make it and prep it.
Cool.
Because you can't just let anyone do this, because you could do it wrongly and you can cause harm. So we only supply those to the patients who've had the training on it. It's like if when women go for fertility clinics, they're given all the injections and everything.
Yeah.
So it's the same kind of principle, is that we're doing clinic treatments for them to do themselves at home. And because there's a lot of clinic toolkits that we have with higher amounts of growth factors, which is useful for the patient, but it's not convenient for the patient to keep coming in for those treatments. So it's better to have it as home care. But we've created that now.
That's got to be the like latest thing, right?
Yeah. That's a new thing we've just launched.
Cool.
So,
It's got a special name.
We're creating the name at the moment.
Exo.
It's
Exo.
but exosomes are certainly. But after a hair transplant, exosome could be really good for repair.
Could they have exosome after SMP? Would that help the? Does it need a bit of helping hand after SMP?
So SMP, my clients are so very different. So I had clients who's tried minoxidil and it didn't work. All these like pills and potions that they tried and they didn't work. They don't want to go through hair transplant because they have long hair and they don't want to shave their
the patch
hair.
in there.
They don't want to go through surgery and they want more like an instant, faster results. So they do SMP, and then like they do other treatments like PRP on the side.
So, I think the work that both of you do is very different to the work that I do. So, both are you do very artistic work, very intricate, delicate work, in the sense that you put something in there, but then the rest of the hair that's around it, that's what I look after.
Yes.
Yeah. So, we're looking after the whole field, and then you're putting key areas in. But if they don't look after the rest, what you guys do eventually then doesn't look natural.
Yes.
Yeah. So it's about keeping it natural. So
the 3 combination is very important.
Yeah, we are the hair factor.
Yeah.
but certainly with your clients, whatever they've been using, it may not have been the right thing.
Yeah, they should have done the DNA test and everything to
But
see.
also underlying issues, people walking around with type 2 diabetes, underactive or overactive thyroid. These are all things that help the hair follicle get destroyed. So we want to do bloods as well to check if there's any underlying issues. The other thing is also their lifestyle,
The
smoking.
diet,
Oxygen is really
Drinking.
key. When you're a smoker, your oxygen levels reduce, which means you build more free radicals, which then destroys the hair follicle.
Alcohol as well.
Alcohol. So these are kind of lifestyle things, and kind of the up and coming supplement that we're now using in clinic alongside kind of the TrichoRx, but more about longevity, is NMN, which is the precursor to NAD+, which brings out ATP. So these are all to do with the cell in the body has a mitochondria, which is the energy part of your cell. And we're programmed as humans from the day we're born to die. Yeah, and that's called, we call it mitochondrial dysfunction. So as we age, at a certain age, we reduce the amount of NAD by 50% when we reach around 40.
Oh, I see.
So what we want to do is NAD therapy.
Oh, I see. Is that the drip?
No, you take it as a supplement.
Oh.
Yeah, you put it under your tongue.
Yes, that's a lot.
And it absorbs. The hair follicle is aging, and that's why we get hair loss. So what we want to do is reverse our age, and we can do that biologically
By taking NAD.
by taking longevity supplements.
What is a good age to start taking NAD?
So you would take NMN, which is a precursor of NAD, and you would start that kind of
Mid-20s?
25 to 30. But again, if you have a really bad lifestyle, then earlier. But then as you get older, your conversion of NMN to NAD reduces as well. So you need a combination of NMN and NAD.
I see.
But then also your whole lifestyle, changes as well.
Fascinating.
Yeah, it's all good. There's too much here. And this is why, when I have to step back when I'm doing my consultations, because there's so much information for patients.
Indeed.
So we have to do it step by step. And the way we start is, let's start with data. Data is the most important. Let's know about you, hair history, kind of your medication, social, etc. We do your DNA profiling and we get your bloods. That's where we need to start. That gives us a foundation of where we need to be. Then as patients start doing treatments, like your patient after 2 years may think it's come to a standstill. So then we add other therapies,
It's almost a constant tweak and a constant adjustment to the regime and to stay ahead.
Yeah, but it's all about prevention. Yeah, but again, each year our body's changing. Each decade we get to, our body's changing. How we deal with things, how medication respond, it all changes. So sticking to the same thing all the time is not the right.
I've no doubt there will be patients out there who've been on a subscription on the typical minoxidil and finasteride, and
Yes.
they have seen the plateau of it. They really should be get a little bit of a review and on
100%. Yeah. I welcome any patient to have a consultation and, let's reframe your treatment.
Absolutely.
Where are you based?
I'm based in Kent, but I do a lot of consultations online.
Okay, nice.
Patients don't necessarily need to come to me because it's all data driven. So we send out the kit to them. If they can't get blood tests from their GP, we send the kit to them. They do a finger prick. They get their blood test done. I look at the readings and then decide, which way we're going. If I see anything that I think is concerning for their general health, then I will write to their GP and say, look, this is what I've done. This is a test. I think you should do further tests and look after our mutual patient. But my focus is their hair follicle. But if I see, because being a generalist as a pharmacist, I see other things and, able to then, hand over to the GP to look after that. With women, it's all about hormones and menopause. With men, we want to look at those lifestyle kind of diseases like type 2 diabetes, smoking. So there's different elements to it. But the only time I get patients to come to see me is if I suspect, especially when it comes to things like scarring alopecia.
Yes.
If I suspect that, we would need someone to look at that hair follicle with a dermatoscope. So, it may be that I send the patient back to yourself to assess because they live around here, or we have connections with other practitioners, trichologists or dermatologists, whatever's near that patient. We also have sent out little like microscopes for patients' phones, so then they can take pictures and then send to us.
That's amazing.
Yeah, so we've got a really good system because if I'm doing a Zoom consultation,
You can't see it in depth.
no, but we have a good process. So we're doing the consultation on Zoom. On my screen, there'll be a QR code.
Wow.
They take the QR code on their phone and then they take the picture, and instantly I see the high-res picture.
Oh, wow.
So we've designed it so we can look after every patient possible. We've got international patients as well.
Yes.
So that's how we look after them.
That is so cool.
Yeah, it's good.
Very high tech. I'm very impressed.
But it makes our day
Easier.
more interesting as well. No, it's just sometimes when you do the same thing,
Yeah.
you kind of plateau. But yeah, I like interesting cases because I feel I learn and I become better at what I'm doing.
Well, I certainly learn a lot in talking to you both here today. So great. We're out of time in here, but thanks both so much for joining me, and it's been great to have you. So we're sure to have more of this useful conversation in the future. So thanks again, both.
Thank you. And it was really good seeing you as well.